Over the last decade, really, the UK has led the way in surgical trials in mesothelioma. We've done the MARS-1 trial and the MesoVATS trial. And currently we have two trials on the mesothelioma portfolio looking at new surgical approaches. One is the MARS-2 study and the other one is the MesoTRAP study. So the MARS-2 study, first of all, is looking at whether an operation called a pleurectomy decortication can actually benefit patients in terms of their overall survival and their performance and symptoms, as well as looking at cost effectiveness questions. So this is a major operation which involves, through an open thoracotomy, removing as much of the tumour, ideally all of it, from around the lining of the lung as possible, but it spares the lung. We don't take out the lung. Now, the study, which is running in multiple centres across the UK and is recruiting extremely well at the moment, involves patients initially, if they're suitable, they have to be pretty fit. They have to have disease which is potentially surgically resectable. They're then consented, and initially they receive 2 cycles of chemotherapy. They have a CT scan afterwards to make sure the disease hasn't progressed. And if they're still suitable, they're then randomised either to have the surgical operation or not have surgery. And then everyone afterwards has up to 4 more cycles of chemotherapy. So even patients who aren't randomised to the surgical arm, in fact, have the current standard of care, which is up to 6 cycles of a platinum and pemetrexed chemotherapy. So with this study design, we'll then be able to address the question as to whether the surgical procedure benefits patients, as I've discussed. As I said, it's recruiting extremely well. The target is 326 patients, and as we speak, we've got to about 285, and we hope to have recruited all the patients by about June, something like that. So, you know, we're encouraging everybody. It's really brought the community across the UK, the mesothelioma community, together. There are multiple sites recruiting. And of course, we're also collecting all the data in at the moment, so we're making sure data completion is as good as possible. And this is going to really address that next big question in mesothelioma surgery: does that operation help or not? So, you know, people should look out for the results of that coming out probably sometime in 2021, 2022, once we've done all the follow-up and that sort of thing. The other study which we're running is called MesoTRAP. So one of the problems for patients with mesothelioma sometimes is when the tumour grows over the surface of the lung, it causes the lung to partly collapse and fluid to build up in the space between the outside of the lung and the inside of the chest wall. Now, you can drain the fluid out, but if the lung is trapped, it can't re-expand properly. It's a bit like thinking about an orange where the flesh of the orange inside is covered with a really thick rind. By removing that rind, potentially you can re-expand the lung. Now, this is a problem for some patients who go through repetitive cycles of becoming breathless because the fluid accumulates, then having to have a drainage procedure to get rid of the fluid, but because the lung can't re-expand properly, they get breathless and they just go round and round these loops, and often their condition sort of deteriorates fairly rapidly. Now, people are divided about the best approach to this. Either should you do a surgical operation to remove that tumour over the surface of the lung to allow the lung to re-expand, or do you in fact not do surgery at all, but simply put a small catheter in between the ribs into the space between the lung, drain off all the fluid on a daily or other days, every 2 or 3 days basis, and sometimes the lung can re-expand naturally by itself, or even if it doesn't, you're still controlling the fluid so people don't get breathless. And that's called putting in an indwelling pleural catheter. So either the keyhole surgical operation or an indwelling pleural catheter. People have been divided about this for quite a long time, what's best to do. So what we've decided to do is initially do a feasibility study It's been funded by the National Institute for Health Research, the Research for Patient Benefits Scheme, and we're trying to recruit up to 38 patients to be randomized either to having the surgical procedure or having a catheter put in. And again, we're looking at the feasibility of doing that, the cost effectiveness, and various patient-related outcome measures around breathlessness and chest pain. Now, it's true to say it has been a difficult study to recruit patients to, because often these patients are very poorly indeed. As I said, they're going through these repetitive cycles, and their overall performance status, as we call it, is rapidly declining. So in addition to the main randomized part of the study, we discovered that we were missing quite a lot of patients going into that study because they just weren't fit enough potentially to have surgery. So in parallel with the main study, we've set up an observational study whereby we're trying to capture as much information as we can about what happens to these patients if they just have normal medical care, because we think that will also be very valuable. At the end of the day, we're trying to find out, how prevalent, how common is this trapped lung problem? Because if you ask lots of different doctors who specialize in mesothelioma, you'll get a variety of answers. So we're already getting some information around the prevalence rates. We should get a lot of information around the sort of symptoms that patients have. And as I say, we'll begin to answer this question about which is probably better for patients, either the surgical procedure or the catheter approach. Depending on the outcomes of that study, we may or may not progress it to a full phase 3 randomized study. I think given the problems we've had recruiting up until now, that's looking less certain. But I think hopefully we will have enough information from this study as it is to begin to inform the wider mesothelioma community, both clinicians and nurses and patients, as to the best approach to take.